Hello and welcome. Today, we're diving deep into a condition that can affect your ears, particularly during flights, scuba diving, or other activities involving significant pressure changes, barotraumatic otitis media. Join us as we explore its causes, symptoms, treatment, and prevention. Barotraumatic otitis media, often shortened to ear barotrauma, arises when there's a disparity in pressure between the air inside your middle ear and the external environment. This pressure imbalance is most commonly triggered by rapid changes in altitude or water depth. Activities like flying, especially during takeoff and landing, scuba diving, or even hyperbaric oxygen therapy can be culprits. Nasal congestion due to allergies or a cold can also increase the risk, as it impairs the eustachian tube's ability to equalize pressure. Now, let's understand what's happening inside your ear. The eustachian tube, a small passage connecting the middle ear to the back of your throat, is designed to regulate pressure. When external pressure changes rapidly, the eustachian tube needs to open and close to equalize the pressure inside the middle ear with the surrounding environment. If the eustachian tube is blocked or unable to function properly, the pressure difference can create a vacuum in the middle ear. This vacuum pulls the eardrum inward and can cause fluid or blood to leak into the middle ear space, leading to inflammation and discomfort. In severe cases, the pressure difference can even rupture the eardrum. Barotraumatic otitis media is a relatively common condition, especially among frequent flyers and scuba divers. Children are also more susceptible due to their eustachian tubes being narrower and more horizontal, making them less efficient at pressure equalization. Individuals with pre-existing eustachian tube dysfunction, nasal congestion from allergies or colds, or other upper respiratory infections are also at increased risk. The symptoms of barotraumatic otitis media can range from mild to severe. You might experience ear pain or discomfort, a feeling of fullness or pressure in the ear, muffled hearing, dizziness or vertigo, and in more severe cases, nosebleeds or bleeding from the ear. Tinnitus, a ringing or buzzing sound in the ear, can also occur. If you experience any of these symptoms after activities involving pressure changes, it's essential to seek medical evaluation. Diagnosing barotraumatic otitis media usually involves a physical examination by a doctor or audiologist. They will use an otoscope, a lighted instrument, to visualize the eardrum and middle ear. They will look for signs of retraction of the eardrum, fluid or blood behind the eardrum, or a rupture. An audiometry test, which measures your hearing ability, may also be performed to assess any hearing loss. Additionally, tympanometry, a test that measures the movement of the eardrum, can help determine the pressure in the middle ear. While barotraumatic otitis media isn't typically classified into distinct types, its severity can be categorized based on the extent of damage and symptoms. Mild cases might involve slight discomfort and minimal fluid buildup, while severe cases could involve significant pain, hearing loss, and eardrum rupture. The treatment approach will vary depending on the severity of the condition. Treatment for barotraumatic otitis media aims to alleviate symptoms and restore normal middle ear function. Mild cases often resolve on their own with simple measures like chewing gum, yawning, or swallowing to encourage the eustachian tube to open. Over-the-counter decongestants or antihistamines may be recommended to reduce nasal congestion and promote eustachian tube function. In more severe cases, a doctor might prescribe pain relievers or antibiotics if a secondary bacterial infection is suspected. For severe cases with persistent fluid buildup or eardrum rupture, a myringotomy, a small incision in the eardrum to drain fluid, may be necessary. Rarely, surgical repair of the eardrum may be required. Prevention is key to avoiding barotraumatic otitis media. During flights, use decongestants or nasal sprays about 30 minutes before takeoff and landing. Chew gum, yawn, or swallow frequently to encourage eustachian tube opening. If you have a cold or nasal congestion, consider postponing your flight or dive. During scuba diving, descend and ascend slowly and use proper equalization techniques, such as the Valsalva maneuver, to equalize pressure in your ears. Avoid diving if you have a cold or nasal congestion. Children, especially infants, may benefit from sucking on a bottle or pacifier during takeoff and landing. The prognosis for barotraumatic otitis media is generally excellent. Most cases resolve completely with conservative treatment and preventative measures. However, untreated or severe cases can lead to complications such as persistent hearing loss, chronic middle ear infections, or even permanent eardrum damage. Recent research has focused on developing more effective decongestants and nasal sprays to improve eustachian tube function. Additionally, advancements in surgical techniques for eardrum repair have improved outcomes for patients with ruptured eardrums. Always consult with a healthcare professional for proper diagnosis and treatment.